getting ready to answer her calling. This 37-year-old is dedicated to caring for society's needs in one of the oldest professions, but that as understood by Englishman Rudyard Kipling.
Interacting with people, helping people, after helping people, I would feel satisfied, and I decided maybe it's what I want to do.
For the past 18 years, she has learned that nursing is not just a qualification, but a lived experience. Starting out, she never imagined nursing would give her such purpose.
When my father passed on in 1999, I was at ML Sultan Technikon, and they decided that it will take time for my father's funds to be available, so the best way was to go and study nursing because we were not paying then, we were receiving stipend. That's how I got into nursing. It was not my choice initially. I didn't like it, but it was the circumstances. But when I joined, I fell in love with it. I discovered that it is my calling.
Mdleja's story is not different from that of Albertina Sisulu. Sisulu's first career choice was teaching, but ended up in nursing because she would be paid during training on arrival in Johannesburg in 1940. Alongside her activism, the political icon is revered for her selflessness and need to heal a community broken by apartheid. Sisulu, as she's fondly referred to, would ensure her empathy is shared by those who would follow her. Albertina's work as a nurse ended with the 1989 death of respected Soweto doctor Abu Baker Asfat, with whom she had worked for. On the occasion of her death, South Africa's medical community ensured her legacy is remembered.
Young nurses in particular could learn a lot from people like Sisulu. One of the things that they ought to learn is perseverance and loving what you are doing and have confidence in yourself.
It's important for the young ones to learn from, the great leaders like Sisulu that commitment is most important.
We drew inspiration from her as a true revolutionary, but as a warm mother, but also as a dedicated health worker with a lot of compassion. She's an embodiment of what we think true nursing is all about. She's one health worker who knew long before many of us were born, that there can never be true health care under apartheid South Africa.
I've also learned from her life, like many of my colleagues have, that caring for patients also means taking interest on what circumstances make them vulnerable for diseases and death. And Mama Sisulu would not only look at a hungry child and just give medication for lesions. She would also find out how the family is and what causes the family to be so malnourished and also poor.
This demand for selflessness is among many qualities embodied by Nontsikelelo Albertina Sisulu, echoing the mantra of the profession's founder, British social reformer, Florence Nightingale. Much like the previous generation of health workers, many of today's nurses represent the flower of the seed planted generations ago.
They paved a way for us because now we are able to work wherever we want to work, and we are able to expand on nursing and do other things. Like I am the nurse, but I'm not working in hospitals. I haven't been working in hospitals for 15 years now. I am working in the industries. So I think Aboma Sisulu, they brought that change that we are now able to explore nursing and do other things.
As Charity Mdleja lives for another day to heal, she is guided by the ethos of her torchbearers like Florence Nightingale and Albertina Sisulu, that a nurse must have a strong inexplicable desire to serve and preserve humanity above all else. Nompumelelo Mthethwa in Johannesburg for SABC News.